Welcome back to the Tech Factor podcast by Purple Quarter. We're so happy to have Mahesh on our show. Mahesh, welcome to our show. Thank you so much for doing this early hours today.
Thank you, Roopa. It's our pleasure. What you're doing is so great. We just talked about it, so it'll be great to provide our story to the audience.
Awesome. So, Mahesh, just so that the audience know about you a bit, you finished your BTech in E&C from IIT Madras. I guess that's a question I'm going to pick on. And of course, you did your MBA from IIM Kolkata and went on to being part of companies, software company, banks, and then became an investor. And 2013 is when you launched MedGenome, if I'm correct. Right. And while you said you started off in 2008, it got launched by 2013. So I'm super curious, right? E&C engineer getting into something which is completely not so relevant from what you did even during your career span into health. How did that journey begin for you?
Yeah, it looks like a disconnected journey, but it's actually quite connected, at least in my head. So the background that I come from, my dad was an airman in Air Force. And I was growing up largely in the 80s. So I traveled across India because my dad was getting posted to different cities. And the prime concern during those days was Garibi Hatao. India, we all talk about the 1983 cricket win, but India wasn't the leader. India didn't have any swagger in its step. There was a lot of lack of jobs. People you might remember Mandal Commission, these kind of things were happening. So the thought process for me to get into any platform was to obviously get to the best school, get some education. And that's how I went to IIT. And IIT was a big learning and learning experience and a turning point. More not just because of what they teach, but the cohort there, the kind of kids who were there. And I happened to be in a hostel which had little rowdy kids in addition to being focused on education. By the time I went to IIT, I had just read one English novel, The Treasure Island. I had just watched one English movie, Superman 2. And I hardly sort of okay in English. So when I went there in the hostel, there is this library of all kinds of fiction. And then IIT has a great library with all classics. So read through that, and kids around us are teaching rock music. I had no idea. I only knew Mukesh and Mohammed Rafi. So all of this education is happening, and the widening of the horizon. And you're seeing that the big need for India is creating some good jobs, which are high paying potentially. So as I went to third year, the third year in IIT is where people all decide. And I went to IIT Madras. IIT Madras, 97% of the batch would just go abroad at that time. So this is 89, 93. And people started taking the GRE and then that step. So I gave it some thought. I had a discussion with my parents, and my parents were very high EQ, although they had only done so much education. They said, yeah, whatever you're deciding, we support you. So I didn't take GRE. So what is the way now to create jobs? I have no idea what is business. We just have this notion that if you start businesses, you can create jobs. So came up, let's go learn a little bit about what is business, and okay, where do you learn about business? Someone told me IIM is a good place. So I landed up at IIM Calcutta. And there too, again, I took sort of general management. Essentially, you take courses in everything. Whenever you don't declare your specialization, it becomes general management. And I again read a lot of books, just talked to people. So there, again, a twist was that you can take the regular consulting, or at that time, IT also was giving some jobs. This is 95. and a lot of excitement had started because of liberalization. So I thought if we are to learn how to make companies and jobs, you should find a startup. So I didn't take a job I had a job, but I didn't take that job from campus. So which was, again, thanks to my parents, they supported that. So I found a little company, joined up, and that's how the software journey started. And I started this with funding from that company. I started Dr. DWG, which was a CAD viewer product company. That again, 95, India was not doing product companies. It was largely services focused.
Right.
So that's how the journey started. And because any company can't create jobs if there are no sales, right? So that big realization happened. I can't hire salespeople. Sales are all in the US. So I went to US after building the product to sell those, assist with selling, and I was the salesperson, etc. And slowly that company did a lot of core products for companies in the US like HP, Microsoft. We created some software. We would do deep tech work, BIOS, things like that. And then 2001, so 2000, obviously, .com crash was there. So we had some extra time on our hands. Our own business was tough. And 2001, Genome was mapped. So exciting, right? So Genome being mapped means biology now has a straight direct link with math.
Right.
And given our education system, the way it works, after 10th grade, you either learn biology or you learn math. And not only that, the math people think they are superior to the bio people. And I'm sure the bio people think but the skill sets completely diverge. And this required bringing those skill sets together. So this looks like the source code of life is out there, and we have been used to working with source code. Okay, so that we can identify the bugs, and then if bugs are fixed, all problems will be fixed. So we are naive to do this thinking, but sometimes being naive is also good to get started on a journey. So that's when I started learning along with the founder of MedGenome, Sam Santosh. We took courses in Berkeley. We just slowly kept learning.
Sure.
And it's a long journey. Biology is not easy at all. And when you look at how biology comes, right, even how the world has also evolved. So math was first, and the people who knew math won all the wars and had good civilizations. And from math came physics. So then whoever had Archimedes, he created the lever, and they won all the wars. And then you need to know math, physics together to know chemistry. Those who knew chemistry created the bombs. They created the bullets. So all three of those then won that century. So now if you take all three of these, math, physics, chemistry, then you can learn biology. And this century is won by biology. And we are already seeing that biology, COVID saw how biology runs the world. And more things are happening, whether it's gene therapy, whether it is storage of data into DNA. So many things will happen with biology. So it's a long window opportunity to work on biology. So we kept learning. And like I was saying, in 2008, Sam had started an incubator here called Genome, and I started a holdco or a VC company, investing company called Emerge Ventures. And we came together and started some of these companies. And MedGenome is one of them.
Sure. So we were earlier discussing about genomics, right? So we also spoke about how there's very little exposure around genes. People only understand from a perspective of thinking that, hey, DNA can solve for everything, or, I get to know everything about diseases that happen around and I can probably curb them. I've heard certain path labs also talk about it quite a bit, that you can actually solve for a lot of things through your gene therapy, or I don't know what you call it, genomics or DNA or whatever. So what was the most underlying thing you were looking for? One side you had people like us ignorant, right? Not knowing what this is all about. So what was, there's a social impact which can only get to a place when we understand what you're solving for.
Yeah.
So what has been your journey? I'm sure it must have been tough. So can you talk about that in terms of, yeah.
So I think as new technologies come and they are complex, what you're saying is absolutely right. Even the people, in this case in healthcare, the guardians of healthcare or the guardians of patients are doctors, right? So the doctors have to start believing that good science can be done in India. And good science is initially expensive. So when initial days, we had multiple challenges, right? So if I categorize those challenges into 3 buckets, one is the awareness. And second is accessibility. Is the test available at all where you are? And third is affordability. So all 3 had to be worked on because the cost of genetic sequencing was very high. In 2001, when this genome is announced to be mapped, to have been mapped, it is $3 billion for sequencing one human genome.
Oh, wow.
And this year it is about $350.
Wow.
So that level of improvement in innovation has never been seen in any technology. Moore's law, etc., all are left behind in a significant way. So when we launched our test, it was still $10,000. So that was one of the points by which we launched the company. That it had to get to at least 10,000. So when we launched our test, there were 72,000 rupees for a whole genome, etc. And 72,000 rupees today is $900, but at that time it was almost $1,800. And awareness was very minimal. Doctors were also India. That's the other problem, right? Doctors are overloaded, so they can't keep up with all technologies until they become a little more mature. So when you look at this, then MedGenome had to pretty much work single-handed. And sometimes it's also good to have 2-3 companies come in the same field at the same time. But unfortunately, in India, that didn't happen because of the environment. And these kind of companies take a lot of patience and a lot of investment. That was not available. So we had to do most of the heavy lifting of awareness. So we created continuing medical education classes. We would do 2 of them every week, sometimes. We started from south, then west, then into north. And also you have to do all of these with working very carefully with doctors, right? Doctors are the front end, doctors are knowledgeable, so you have to provide this information while keeping them all in good books. So we worked through it in a very gentle way. The other one was then, can good science be done here? So we would have to do tests, same sample would go to some company in the US and to us. So we would do these kind of things to establish that, yeah, our test is as good as what is available in the West. Then some events happened. The reason to do genomics in India is that India has a very unique population structure. Very few countries or very few geographies in the world have that. So India got its population very early on from Africa. So 2-3 waves came out of Africa, and they came very early. And they started. They got established here. And we kept on having more, for various reasons, more migrations into India. Then somehow we got segregated about 2,000, 3,000 years ago into caste, language, and there's also good geographical barriers. So we would just get, at that time, maybe marriage was there or not, the children were born in small groups repeatedly. So you have these 4,500 groups roughly in India, which are very homogeneous in population. You keep on, I don't want to use the word inbred, but they're having children in a very small group. So that makes them genetically very homogeneous. That increases the genetic disease burden in general. So India more or less has double the genetic disease burden of a well-admixed population. So a country like US, which is well-admixed, So the kind of population characteristics we are seeing within these 4,500 groups would be similar to that of an Iceland. So Iceland, 2-3 boats of people went to Iceland. Maybe there were 15 people, 20 people who have become the 350,000 people today. So they are extremely homogeneous and their disease burden is high. So two things happen with that. One is this disease burden is high. Second, these kind of groups can also be very beneficial for creating or identifying correlating mutations which create these diseases. So that can potentially lead to drug discovery. So our thought was that this heavy disease burden, which comes, it's called germline mutations, inherited diseases, it should be analyzed. There are 8,000 odd rare diseases. And most of them have overlapping symptoms. So at a very young age, the child can't keep their head straight, can't focus, and they'll all be same. So unless you have a genetic test, you can't make out what disease it is. So our tests, other than one or two, are not replacement tests. So if this test is not there, you can't do anything, and that family is left high and dry. So there were unique cases we heard. There was a family in Delhi had 7 children with Kahneman's disease, and they had petitioned to Supreme Court wanting to euthanize them. But why one child is born, why should another child with the same disorder be born at all? And that can be avoided if you do genetic testing and assistive reproduction.
Right.
So that's how we were quite keen to do that. And when we started out, it was a slow journey. And some global events also happened. One, I think this Angelina Jolie gave a lot of publicity to BRCA1, BRCA2 testing, which was well proven and very widely used in the US by that time. So that gave an impetus. People started learning a little bit about genetic testing, and that certain mutations can cause 90% probability of getting breast cancer. Unfortunately, that's not there in other areas. Everybody thought for everything 1 or 2 genes will be found for every disease. That didn't happen. But a lot of good science kept coming. Second, like I said, the cost of the sequencing kept coming down. And the third, test like NIPT came about, non-invasive prenatal testing, which is instead of doing amniocentesis, you can just take mother's blood and know whether there are any gross issues with the fetus very early. So that became a super hit test in the US for all high-risk pregnancies. It just became norm to do.
Wow.
Now, of course, they're talking about doing it for every pregnancy. And it's a low-cost test now. Of course, at that time, it was expensive. So in India, it sells for about $90 now, 7,000 rupees. And it's a test every educated parent should do.
So can I ask you something here while you're at this, right? So there's so much of data that you're talking about. When you're talking about, hey, every person who's pregnant should be doing this, that's a data point, right? But when you actually equate it with, are they really doing it? What does the data look like?
Very few people are doing it. I think in that, so leave alone non-invasive prenatal testing, which is genetic test. There are basic tests, double marker, serum marker tests, like double marker, triple marker, which will give you a sense that they're about 80% accurate. Even those tests, only about 500,000 happen in India, a country with 25 million to 27 million births, which is very sad. These tests are only 800 rupees. So then a subsection of that, maybe about 70,000 to 100,000 people do NIPT tests. And 1 million or 1.5 million births are happening to educated people in urban areas. In spite of that, this is the situation. So slow and steady. Yeah, I think some of it is behavioral changes, some of it is awareness.
Sure. So with some of this data that you brought about, not just about people who are pregnant, right? You also spoke about how you can leverage some of this data. So how has MedGenome gone ahead and helped with advancement in maybe the health part of for science or for diagnostics, right? So could you talk about that?
So we are the only company which has created all our tests, other than this 1 or 2 tests like NIPT, which we have licensed.
Right.
So that comes from essentially doing research projects in India. Indian populations are slightly unique. So we have even created a microarray chip called Sargam, which has the unique variants of Indian population, by which the tests become cheaper. We operate in 4 areas. First area is this inherited diseases. Second one is birthing, like I was saying. Third is oncology. And then nascent one, new one is infectious diseases, where we have the first sequencing-based, sputum sequencing-based TB test. So we can tell exactly what organism is there in the TB without no culturing, nothing. When you culture, roughly 60-70% of the organisms won't grow. So here you just take sputum and 100% of the organisms can be sequenced and identified. So in each of these areas, then I'll tell you about the fifth one, which is more screening. These are the diagnostic tests. And the fifth area is screening for where a person who is not yet ill. It's called Polygenic Risk Score. So we have tests now by which we can say what is the risk of getting cardiac disease, what is the risk of getting diabetes, what's the risk of getting a high BMI. We have 7-8 tests in that, and we are launching another 7-8. Again, we are going through the clinical channel for all of that as of now. So the first area, obviously, inherited diseases. There are a lot of unique issues that Indians have. Or Indian population. So there are papers which have been published, scientific papers, that Vaishya population has certain diseases which are found only in them. They might not metabolize anesthesia, and it's dangerous for them. So knowing that is good. So we have, when we keep on getting the data, we keep accumulating, and that is how we have built our software to analyze this data. So ML, AI, etc., gets trained based on this data. So 2 things happen from a diagnostics point of view. 1, new tests come out. 2, they are more accurate. And then 3, because ML AI is doing more and more of the work, we keep on reducing the cost year over year. So the test that started at $72,000, which is $1,800 at that time, today we sell for $150.
Oh, okay. So if, I heard you say, I'm taking a cue from what you said earlier, you spoke about how, because India has this piece of having, because it's inbred, right? You mentioned that. So I wanted to understand, so is it true in terms of, diabetes being genetic? Some of these that you picked up at the end saying that, hey, some of these can actually be figured out earlier. So are these genetic diseases or,
So many of the lifestyle diseases are genetic. They have genetic component to it. So diabetes, hypertension, the more complex diseases, right? So these complex diseases, unfortunately, are not based on just one gene. So the 25,000 genes, we will, it'll be a little weightage on various parameters. So that is what I was saying, the polygenic risk score. So polygenic, multiple genes, poly. In each gene, then certain mutations will be there. So we pick, we read about 1 million, and then we extrapolate that to 6.6 million points. And each of those points, this is research done by Broad and us. We have done tweaking of those algorithms using the Indian data. Broad Institute is one of the leading institutes for genomics in the world. So each of those mutations is given a weightage for risk factor. And then when you aggregate that, the population will come in a nice normal curve. And whoever is on the top 10-15%, there's a very high correlation, 85%, 90% predictability that they will develop some issues. So in many cases, if there's family history, then it is clinically actionable. The person should immediately do lifestyle changes, definitely. And then if there's a lot of family history, maybe they get on some kind of clinical intervention. So all of the lifestyle diseases have this now.
Right. And I think this would actually lead to a lot of preventing some of these lifestyle diseases. This was done.
Absolutely. Yeah. So if people, and I think 23andMe had 1 or 2 of these tests. So they have done a study which clearly shows that being aware, people make and stick to lifestyle changes much more than when you are unaware or you're given generic information. If you're told that you specifically have triple the risk of everyone else for getting cardiac disease, the people comply with a healthy regimen that much more. So if that knowledge is available to everyone, great, right? And in some cases, it's not just percentages. So some of these tests we have are about pharmacogenomics. So statin, how do you respond to statin? Or how do you respond to beta blockers? So again, I can, because I can easily talk about myself. So recently I was for something given a eye drop which had beta blocker. Beta blockers slow down the heart and calm you down, etc., etc. So I have, as it is, lower heart rate, and just 10 days of taking this eye drop brought my heart rate down to 35,
Oh Lord.
which is scary. So I respond very, very well. So if you're aware, then because this was just an eye drop, so I will never take a oral beta blocker, etc. Right? So this is very valuable and life-saving at times. And a lot of medicine still is the dosage. We get the same tablet, 120 mg, 300 mg, 500 mg. The calibration of what one has to take is trial and error
Right.
still.
And most of the times, even when the doctors ask, what are you allergic to, what do you know? Most of us don't know, right? At the end of
exactly.
the day. Right.
And yeah, so some of those critical drugs, statins, etc., the pharmacogenomics test can say, what are you? Then there are some further more interesting, science is at early stages for this, so it's still progressing. So we have a test which we have just launched, which can tell you your biological age versus your calendar age, and how, what is the pace of aging right now. So if you look at this, lot of very interesting work is being done by David Sinclair and a few of the scientists there, Harvard-based. So there are a couple of clocks, Dunedin clock, Howarth clock, based on methylation of DNA. So if you look at it, at a given point of time, your age might be 10% more than the calendar age, and your pace of aging might be 10% faster. Then intervention can be done. There are some of it is supplements and some of it is lifestyle change. Then you do the test again, you can see that the biological age has come back in line or even less. So we've been seeing that for some people.
Yeah, very nice. So just wanted to check with you. So do you have competition? Because this seems so new and nascent. I've heard certain Ayurvedic companies also speak a very similar language of, biological aging and all of that. So just wanted to understand, where do you guys stand from?
So from genomics, and I don't know if you want to call it the Western science. So we are a science-based company first, right? If you ask what makes MedGenome different, we believe in science first, and then how can that science benefit the patients? That's how we go. So there are, if you look at it, direct competition who do all the things I was saying, there isn't any company. But there are companies, there's a company called Strand, which had created own IP in oncology at least. Then companies are always, India has a lot of companies who can buy and resell, right? So there are a few companies like that in the market. But there isn't any company like MedGenome, which has all the IP and the data, and we are constantly improving, focus on Indian population. So now we are extending that focus to Africa, Middle East, all the emerging markets, which are not getting the attention from research that Caucasian populations are getting.
Right. So is it hard when you're also an investor, you're part of, you're on the board for a lot of companies. So is it hard having a business mind versus, being very focused on health, which is patient focused, people focused? It's two separate worlds, right?
Yeah.
And you're one person. So how do you actually?
Yeah, it is. It's a difficult balancing act, but we're very fortunate sometimes. Right? So I'm obviously not the scientist. So we're very fortunate that we have Dr. Shekhar Sheshagiri, who is 21 years at Genentech. He's our chief scientific officer, a great brain for oncology, and he was one of the leading people for sequencing. We have Dr. Ram, who heads our India diagnostics business. He's a PhD in genomics early on, and then with a great brain for business. So then for bioinformatics, we have really good people who early on moved back from US, Dr. Ravi, etc. To that, so I can limit myself to learning enough science which focuses on impact rather than the nitty-gritty. If you ask me to do a report today, I can't do it. Second, we got a lot of good support from investors. We got a good investor base early on. Sequoia, which is peak 15 now, then Sofina, Leapfrog, and recently Novo Holdings, IFC. Novo is the largest life sciences fund in the world. So they understood the opportunity, they understood their patient, they have the long-term vision. Sofina is a forever fund, Novo is a forever fund. So those are the kind of good partners came to support, and they understand some things take long in gestation. And we are, for example, we have liquid biopsies, 4 of them, which is you can just take a blood sample and you can know if there is cancer, residual cancer, etc. And we are working on early detection of cancer, liquid biopsy. That building itself will take 3 years, 5 years. So they work with us. So that has been fortunately, we have been able to present our case to these people to either come work with us or partner with us or support us.
Very interesting, Mahesh. Very interesting. Just one last question before we wrap up our show, right? So you've played both these parts. What is your advice for people who want to start their own startups, budding entrepreneurs, or let's say people who are watching the show and totally inspired by your journey? So what is a piece of suggestion you'd like to give them?
In the life sciences sector, in core innovation, I think it's a little different compared to other areas. There are many areas where entrepreneurs come in a couple of different ways. One, they just are in love with the idea of being an entrepreneur. Second, are the people who fall in love with an idea and then become an entrepreneur. So the first kind of people will always hunt for an idea and then they look at opportunistic things and they'll jump on it. The second kind of people, I guess they have it harder and they fail more, etc. But they will find a niche and they become committed to it, and then they go at it. So first of all, you'll have to figure out what kind of entrepreneur you are. If you are the entrepreneur who just really likes being entrepreneur, and both of them are good for an economy like India. So if you're a second kind of entrepreneur, then go for life sciences and deep tech kind of businesses. If you're the first kind, don't, because this is a long journey and a deep journey. There's a lot to be known. Education, healthcare, these are industries which are credibility-based businesses, right? So credibility and impact takes time. Just first 5 years goes into just finding your footing, and then only you can start your journey. So that is one. Then second, I think have to just recognize that deep tech, one person cannot do everything. You need a solid team, and 2 people also cannot do everything. If you want to make big impact, bring a team of 5 to 10 with different skill sets. And so some of them can be the people who are taking care of finances. Some of them can be the idea people. Some of them are the tech people. That's a must do. Without those, you shouldn't start on this journey.
Wow. That's an interesting piece of advice. Complementary skill sets together is what you're saying.
Yeah, and it's a long journey. One is skill sets and 2, the personalities, right? You have to last together for a long time. Yeah.
True that. Thank you so much, Mahesh, for doing this show with us. It's really lovely having you. And I'll definitely check out your site and see what tests I can take as well. This has been really a lot of awareness I got on this show.
That's great. Thank you very much for inviting me. Please come to our lab, and maybe you can even give your sample at that time.
Sure, absolutely.
Look forward to it.
All right. Thank you so much.
Thank you.